Hello everyone, thank you so much for your support on this channel. So today I am going to talk about NAC OSCE since that's the one of the exam coming up next. So let's talk about NAC OSCE overall. So in my experience, I've done my NAC OSCE in 2023 September, and my location was in London. So I will share my experience how it was and what preparation did I do, and also I would also give you some tips and tricks to prepare for this exam. And luckily I was able to pass the exam on first attempt with good score. So I would give you all the tips and tricks that helped me, and anything that you can write down in the questions below. So let's just start and know what NAC OSCE exam is. So this is for people get notified when application for an upcoming sessions open. So this is for people who are doing exam in September and is waiting for the date. So make sure you sign up here just so you get notified on whenever the registrations open, because the NACOSCI registration really opens up for some period of time. That means a week or 2 weeks. So you need to really register in that time. So, what are the things they test you on? They test you on history taking, diagnosis, management, communication skill, physical examination, investigations, and data interpretations. So, there would be stations where they would ask you to do history along with examinations. They would ask you to do counseling that would assess your communication skills. They would ask you to take history and then interpret the results they might have. And then they may also ask you to give a management plan to a patient. So it's a mix of everything. But what is the most important, crucial thing that I learned in that exam was the communication skills. That is the most important thing they would assess you on. So what is important for this exam is if you are able to, because I've heard like many people saying have good communication skills. So what are the good communication skills? When you should feel confident about if you should take NACOSCI or no. If you're able to say, or if you're able to speak up what you want to say, then you're comfortably in English, then you're ready for NAC exam in terms of communication skills. If you're able to speak up anything that you want to say in fluency in English, then that means your communication skills is good enough to attempt the exam then. Okay, in terms of communication skills, but you have to have a good clinical skills as well in terms of examinations and history taking, and that would come with practice. Okay, so now going to the eligibility and application. So you don't really have to do QE1 first or NACOSCI. It's all up to you, but I would suggest don't delay it. If you've done QE1, go ahead with and book your NAC exam. Don't wait for your QE1 result and then book NAC. No. So for people who are doing, let's say, QE1 in May, you can just directly book your NACOSCI for September now. But if people who are waiting and seeing which exam to do first, if you're comfortable doing NAC, go ahead and do NAC first. If you're a newcomer in Canada, let's say, and you are fresh graduates, or you have been freshly, you're just out of practice, you can do NACOSCI for sure. So that's what I think, and that's what I did for myself as well. You have limited exam attempts, but if you pass the exam, let's say with a low score, so you can redo to make your score better. And the maximum that you can do is 3 times, be it you pass it or fail it, but that's the maximum that you can do. And it's an expensive exam, so make sure you pass it with a good score on the first attempt. And the score matters in terms of like when you apply for residency match, then it matters. For people who are going for PRA pathway or other routes, the score doesn't really matters. But one thing about NAC OSCE is good, that if you're in Canada and you're planning to start your clinical assistantship, let's say in Manitoba, Saskatchewan, you can just apply it with one of the exams. So this exam will lead you somewhere if you have not done QE1 yet, right? So that's that. And now moving to um, the test centers. So they allow you to apply for, let's say, 3 top centers in the portal when you apply. So you apply for exam through physicians apply, and when you apply, they give you 3 options to select 3 top exam centers that you want to take your exams at. Let's say I was in Toronto, I applied for Toronto first as my top choice, and then second was London, and third was Ottawa. I got London as my center, but that was not in my hand. And at that time, I wasn't really aware. Like, I've heard people saying that Toronto is tough and London is easy. Honestly, I would say just do your best, because these things don't matter, because since they're not in your control. So don't really take anxiety of, let's say, if you're doing exam in Toronto and you're anxious about the fact that examiners are really strict at that location. No, that's not the case. You have to really prepare well. You should know whatever you're doing, whatever you're saying is for a purpose. Okay, so then you're good to go. So apply for NAC exam and then test accommodations. If there's anything that you need, you can just mention that, and make sure to sign up just so for people who want to take exam in September. Now if you sign up, they will notify you. So these are the locations they help you take exams. Let's say in Alberta, Calgary and Edmonton. Manitoba is Winnipeg, and then in Ontario. So I know people have to fly to different locations to take this exam. It's a very expensive exam, so make sure you prepare well for this exam so far. All right, so this is it from here. Now I'm going to tell you about the things that I really want to talk about. So let's start with NAC OSCE for people who are going to take NAC in 2025. All right, so what are the things that you need to know? First thing is history taking. So for history taking, you need to know the pain OPQRST, right? OPQRST. So that's the one thing that you really need to know. Second thing is for examination, practice as much as possible. What I did with examination is I used to use a pillow and used to practice the examination on a pillow. Okay, so you have to take your stat along with yourself. Cardiorespiratory examination is something that you really need to have a good grip on. Neurological examination, let's say with cranial nerves, with let's say patient with Parkinson disease, let's say patient with weakness. So you need to know if a patient is coming in with weakness, what are the neurological exams that you're gonna do. Moreover, let's say if a patient is coming in with chest pain, you need to know what are the cardiorespiratory components that you need to practice on. Other than that, how did I prepare for my exam? So what I did was, like, I give myself 2 to 3 months to prepare, and in those 2 to 3 months I was basically practicing as much as possible history, and I was also practicing examinations and counseling. So 2 to 3 months is really good, but let's say if you don't have 2 to 3 months, you can even go for 1 or 2 months, depending on how confident you are. Okay, the more you practice, the better it is. So I took my mock exams with one of the most common institute in Toronto, that's called StarMed, and then I also did some mock exam with my study partners in the library. So we used to book a library silent area in the library, and then we used to practice there. And then in that room we used to practice and assess each other and give feedback. So most important thing is to have study partners. So how many study partners you should ideally have? You should ideally have, let's say, a group of 4 to 5 people, or not more than 6 people. Six is too much, I would say. 4 to 5 is really good. So a study group of 4 to 5 people, and along with that, you need to have, let's say, the resources. So what resources are you gonna use? I use Edmonton Manual, and also I use the Basel notes. So what I did was I started with Basel notes, and since it's doable, Basel notes is doable. You are able to finish these notes. So start with Basel notes, and then Edmonton Manual is very structured book. Let's say if you really have a good grip on OPQRST questions now you need to go and look into abdominal pain, chest pain, and all the pain questions and pain scenarios for a specific system. So you can systematically go and learn the common presentations from Edmonton Manual, just so you can have a diverse knowledge of the topic that you're going to read, because it gives you differentials, it gives you the management plan, it gives you everything. So Edmonton in terms of the systems, and Basel notes in terms of having a template or having a good idea of each topic. Okay, so start with Basel notes and then go to Edmonton Manual rather. Now coming to after resources, coming to the preparation, the counseling part. So you may have stations from counseling, and in counseling stations you have to know the common ones. Let's say diabetic counseling, smoking cessation counseling. The common ones are very important. And what is one thing that I would really suggest you on counseling is keep it conversational, right? Keep it conversational. So it would be a two-way process. One is taking the history plus advising the patient. Okay, so it counseling would be a combination of history and advising the patient. Let's say if you have to counsel a patient on smoking cessation, how would you do it? So start with, what do you know about it? Why do you think you want to do it? So there's a protocol for smoking cessation in admitted manual as well as in basal notes. So if you started, you would know what questions you would ask. But for me, I'm not going to tell you about the things that are already mentioned in admitted manual or basal notes. I will tell you about the things that from my experience I learned, and even from my clinical experience that I've learned, is like keeping it conversational in terms of what is important to you, why would you want to quit it, and or why do you don't want to quit it, or what is important to you. Okay, whenever you feel ready you can come back, and if he's ready now, you would ask why you think you can quit now, what is motivating you, all those questions. And once you ask them, make sure, if you ask, let's say, what is motivating you now, and the patient says, my daughter, she's at her she's in the home, and she sees me smoking, and I feel guilty about it. So make sure to give a comment after that. Just don't just move ahead. Just say, oh yeah, that's really nice that you're thinking about it. Keeping it conversational in that terms, making it more patient centered, like giving a response in a humanly way that as a person you would give to someone. Let's say if he says something private to you, let's say, my mother is sick, she has really done a lot for me in terms of uh, finances or education or social support. He was a, yeah, that's really great, and she's, no doubt, she's a great human being. Commenting something on the patient's statement, just to make sure, just to let the examiner know that you're listening to what the patient is saying, not just saying what you have learned so far. No, you don't have to burp out everything that you have learned from these books. You have to act humanly in the exam throughout, be it history taking, be it counseling, more importantly in the counseling station, because that's where your communication skills is tested. Okay, now going after that, to examination part. So in the examinations usually doesn't come alone on its own. It would come either with history or with the post encounter questions. Okay, so in history or post encounter, what you have to do is, once you read the statement on the door, what you would do is you would now know like what the station inside is. Okay, so you would go inside and take a moment and see what's happening. Is the examiner going to speak to you about something? If no, go ahead and introduce yourself to the patient and ask him few questions whichever is relevant to the station, and then start your examination. Do cardiopulmonary examinations, do neurological examination, or whatever is required, and make sure to verbalize your examination. That is something that I've done, and I would suggest you to do as well. Verbalizing, what are the benefits of verbalizing the examination? One thing is that you're doing something and the examiner is marking you. He's not looking at you. So there might be something that you've done, but the examiner might have missed, not looking at you, or maybe you've done something but they don't know what you've done, right? So it's good to verbalize it, saying that I'm listening to the patient's chest. I'm auscultating the patient's chest to listen for any wheeze. I'm auscultating to to listen for any rhonchi or crackle sound. I'm trying to rule out if there is any signs of pulmonary effusion. So, all those kind of things to show that you're a clinician who is well aware of what he's doing. Okay, now I'm going to palpate the patient's abdomen, and make sure in examinations, be it history, be it overall throughout your NAC OSCE, the most important thing is consent. Don't forget consent in every part that you're doing. History, if you start history, make sure you tell the patient, I am Dr. XYZ and I'm your duty in charge. Is that okay if we proceed with a consultation now? Consent, number one. Now, this is, let's say, counseling station. So you would, my name is Dr. XYZ. I'm your doctor today, or I'm the doctor on duty today. So would it be okay if you want me to start the consultation now? Something like whatever statement you have for consent, make sure to mention that in counseling, exam history, and examination. That would show that you are you're ethically aware of your duties. Okay, so that's that. Consent, examination, histories, counseling, that is covered so far. Now, moving on to post encounter questions. So, in post encounter questions, the examiner would tell you beforehand that they have some post encounter questions, or it would be written on the door sign, that history and examinations, or if even if it's not written, they will let you know. So don't be panic on what do we have now. So you naturally know there would be either history, examination, counseling. Like, there would be nothing out of the space for sure. There would be something from within the course that you've done so far. So for post encounter, it could be differentials. They may ask you the differentials. They may ask you the definitive diagnosis. They may ask you they may give you a picture and may ask you to elaborate it. And that picture could be an X-ray, a chest X-ray, an ECG, let's say an ultrasound, a CT scan. It could be anything. It could be let's say a clinical picture. Okay, it could be a report. It could be anything. This post encounter picture could be anything, and that's where you have to. So post encounter question is something that's very doable in terms of, like, if they would give you post encounter related to the common clinical presentations, nothing out of the world or nothing very tough. It would be very much doable. NAC OSCE exam overall is a very doable exam as compared to QE1. QE1 you have to read a lot, you have to learn a lot, but NAC OSCE you have to practice a lot and be logical about what you're doing, and you have to be you need to have reasoning for whatever you're doing. Okay, so that's that. Moving on to the overall, so that's what we have covered so far. And now the door sign. Okay, now the talking about the door sign and what are the things that you got to do when you read the door sign. So let's say this is the door, and let's say this is the window, and that's where you have the door sign written. And walk into the room that's you walk into the room, and you're reading the door sign, and you have 2 minutes to read this door sign. And in those 2 minutes you do have a paper, a long paper, and a pencil. And with that paper and pencil, you're basically writing your things. So what are you going to write on the paper? As soon as you read the door signs, what you have to the things that you have to pick up, you have to make your notes. Okay, don't make a lot of notes, just write age, gender, let's say 50-year-old male, coming here with complaint. Now what's the complaint? Chest pain. Okay, now, and then the task, history. Let's say they're asking you to take history and perform examination, and there would be post encounter questions as well. So history, now that's how you'll write history, and you have to perform exam, and you have to perform, let's say, post encounter. So have, like, this is the information that you need to take out from your door sign. Let's say 50-year-old male, chest pain, history, physical examinations, and then encounter. That's how I would write in my exam, and that's what you have to write in total. Okay, and if there's any other essential information, you can write them. So let's say you walk into the room, and you greet the examiner, you greet the patient, and you give your sticker. You knock the door first. Okay, so first thing first, knock the door. Knock door, and give your sticker to the examiner. Okay, give your sticker to the examiner, and introduce yourself. Introduce yourself, and you say, hello, my name is Dr. XYZ, and I'm the doctor on duty today. um, so may I start the consultation for you today, please? If the patient is in ER, you will have to see if the patient is, let's say, is something emergency. You don't have to take consent at that meanwhile, but you mentioned about taking the consent in your consultation overall. But you'll take the consent from the patient, and you will start your consultation by saying, what brings you in today? May I know the reason for coming in today? And the patient would say whatever they have to say. And once you've taken the history, you've done everything, you have done his examination. Now, by before ending your examination or before ending your history, you have to ask the patient. That's the practice that I used to do. Ask the patient, is there anything else that you would like to add on? Is there anything else that you would like me to know about you? To make sure that if the SP has anything that they want you to know, to make sure that you're coming to your differential diagnosis, or you're coming to your definitive diagnosis, or you might have missed something during the history and examination. So that's what you would ask the patient, and this is going to help you out in your post encounter, because that's where you would know what you have missed. And once you know what you missed, so there would be nothing left for you to know, right? And now you can answer your post encounter questions, and that would complete your entire stations. Okay, so that's how it works. And so door sign, knowing what you have to extract from the door sign, and then the initial thing, knock the door, sticker to the examiner. And these are the two things that you would do for all the stations: knock the door, give your sticker to the examiner, and also introduce yourself. These are the things that you would do all stations, and then you would proceed with whatever is asked. Okay, and then I think this should be it. Make sure you take your stat along. You have to take your stethoscope, you have to take your lab coat, and dress professionally. And by professional I mean wear comfortable shoes, comfortable dressing, but in a professional attire. A dress code, um, let's say dress pant, dress shirt, this is the basic thing. Tie your hair properly in a way that you're comfortable with. And then have a good posture, have a confident posture, that you are a confident doctor. No matter what you're speaking, make sure you're speaking up loud. The examiner should be able to hear what you're saying. Don't just mumble what you're saying. Okay, and if you're not sure about something, let's say if during the exam you're not sure about something, you're not, you're confused between two differential diagnoses, what is the best way to answer that is you would explain why you're saying so. Okay, let's say if you're confused between a diagnosis of TB and a diagnosis of, let's say, asthma. Okay, so you would say, let's say you think it's a TB and you're not, but you also think it's an asthma. So you would, let's say you're saying now they're asking what is the definitive diagnosis. So you would say, as per as since the patient has a travel history, and the patient has is coming from XYZ country, so considering the risk factor, I would keep tuberculosis as my top definitive diagnosis. Okay, and let's say if you hear a wheezing sound on asthma, and you would not hear, definitely what happened is, if there is any positive finding on examination, the examiner would say, when you say, I'm auscultating for any wheezing or bronchi, the examiner will say positive for wheeze. Okay, if he say positive for wheeze, so since the patient has a positive wheeze on auscultation, he has a history of smoking, he has a history of allergies, my top definitive diagnosis is asthma. So that's how you justifying your definitive diagnosis. When you're confused, justify what you're saying. Okay, so that's how you do it. So that's that. And then this is how you answer the post encounter, like in case of if you're confused. Okay, so even if that's not about post encounter, if that's about any question, just make sure you justify what you're saying. Okay, even for the differential list of differential diagnosis, you're not sure which one to keep on the top. Let's say MI or pulmonary embolism, which one to keep on the top. So considering the risk factor of her diabetes, of her weight, of her medications, I would keep myocardial infection as my top differential diagnosis, and pulmonary embolism as the second one. But make sure, don't be be a safe doctor, and mention anything that is really harmful on the top first. Okay, but since you have anything saying that this is the most likely diagnosis, then you can keep that. But if you think that you're not sure, so you can keep the most deadly one on the top. Okay, so that's that. NAC OSCE, and overall you'll have in total you'll have 12 stations, and out of 12 stations, two are pilot, and this is the information that you already might have. So 2 are pilot means they are not ranked, but they are generally kept to see how students perform, but that's not something that you will be scored on. And 10 stations are the ones that you'll be scored in, and this exam is total scored out of 500 to 700 is a score that you scored on. And I think 577 is the passing one, right? You have to score above 577 plus, and the results come back in 8 weeks. And you're given your station, like you're giving your exam center 4 weeks before the exam. And what else um, what else and this is a half day exam, so you the time passes really fast, you wouldn't even know. You'll have to run between the stations, so make sure that you are aware of how it goes in terms of center. And make sure to have study partners. If you have someone who has already taken the exam, that would be really helpful, because that's how they can literally tell you of their experiences, and then you can really incorporate that in your practice. um, Overall, it's a very good exam. It's a very much doable exam. It's not hard, I would say. They would not give you tough time. There would be some SPs who would give you tough time in terms of if let's say if a SP is giving you tough time, there are two things. Either you're not doing something that you're supposed to do, or either you are not asking them what you're supposed to ask. Okay, so these are the two situations. Doing in terms of what you're supposed to do means that examination wise you've missed something on the exam, or you're not asking something on history that you're supposed to ask and they're supposed to tell you. So make sure, if SP is, at times SPs are trying to help you, so make sure listen to your SPs very carefully and respond to them in terms of what they're saying. Like, be very humanly throughout the exam. I know pressure is real. It's really difficult to be human in that situation. You have to really uh, vomit out everything that you have in your mind at that moment, but make sure to be in that moment. Okay, any stressors, anything that's coming in your mind in that moment, just forget about that. Let's say if your one station goes, is not didn't really go well, so forget about it. Once you stepped out of the room, just forget about everything and just move on to the next. Be ready for the next one. Okay, and just be confident, be happy about you are in the moment. Finally, you're doing the exam finally, because you have been preparing for quite long now. So be happy about your exam, be happy in that moment. Okay, overall it's a very good exam. You'll feel good after doing it. And yeah, that's it. And I wish good luck to all of you, and I know you will all pass with good scores. Now you guys have a lot of material online available. Back in the day, I couldn't really find a lot of material even on YouTube, so you guys are lucky in that terms. And yeah, best of luck to all of you, and I'm sure all of you will do well. If you guys have any questions even before the exam, I'll try to make more content on NAC OSCE. And just comment down below, and I'll try to help everyone with NAC and QE1 on my page. Thank you so much for watching. Take care. Good luck.